eyes, we welcome to the desk a good friend of ours, Dr. Eugene Cherny. How are you, my friend?
Lou, you're my man. How you doing?
Good. How are you?
Good morning. Great, thanks.
So we're talking about something today that can make a huge difference in the way someone looks. Actually, from both ways. It looks both out and in.
That's exactly what we're talking about. There's one thing that you can do if you're going to do like one thing and you want to get the most bang for your buck. You should really consider doing something for your eyes. And a lot of people do things for their eyes all the time because you can't believe how much money is spent on makeup for the eyes, because the eyes are the focal point of the face and they are the window of the soul.
You often hear people when they're trying to guess people's ages, which I'm terrible at, is that they look at the eyes because they can see if they're tired, if they're poofy, if they start having those fun, lines coming out the side. But that's how people can usually tell how old people are, is from the eyes.
It's a giveaway, and one of the problems with facial aging is that as we age, we start to miscommunicate what we really feel like and what we are really thinking. So when your eyes get saggy and you start getting bags here, everybody starts asking you, hey, why are you tired today? Rough night last night? When you didn't have a rough night at all, and people start telling you, oh, I feel bad for you, you look so tired, and you don't feel tired, and you start getting really annoyed with this. I mean, I know that I do. So you want your face to accurately communicate, where you're at mentally and emotionally.
So can creams do things like that? I know women do spend hundreds of dollars on creams all the time.
Zoiks, there's like no cream that works. I'm sorry. I mean, Retin-A might a little bit. That's the only real legitimate.
And what is that?
thing.
What's that doing when you put that on under your eyeball or eyelids?
Well, Retin-A is actually a wonder drug. It really does rejuvenate the skin. It decreases the precancerous tissue there, and it increases the circulation and makes the fine lines less. So I'm like a big booster of Retin-A. Pretty much everybody agrees that was a game changer as drugs go in the 20th century. So.
Now, so what can you do for someone's eyes? What can you do to fix this?
Well, so this is it. The paradox is we talk about the eyes, but what really makes your eyes look attractive or friendly or sad, it's all the soft tissue around the eyes.
Right. So and is it true the tissue around the eyes is completely different than any other skin on your body?
It's very different. It's the thinnest skin in the body, and it is like crazy delicate. This is some really delicate surgery that we do. Here you're looking at someone with age-appropriate facial aging that has been accelerated by cigarette smoking. So what you have is the fat has shrunken, and so the wrinkles are becoming much more evident. So this is typically, you get a little bag below the lower eyelid, and you get the extra skin in the upper eyelid. This is a little earlier case. Here's where you start to look old because the eyes look small. And to make these eyes look better, you want to open them up and make them look bigger. The bigger your eyes look, by manipulating the soft tissues around the eye, the more attractive you look. The more awake you look, the friendlier you look, all those things.
You have big eyes.
Yes, you do.
Jackie does.
Now, a lot of women, I feel like, have an issue as they get older, and it's not their fault, it's nothing they did, but they have what they're known as like a hooded lid.
Yes.
Because everything as we age starts to
sag.
Gravity works, and it starts to go down a little bit, and eyelids can start covering up as well, and can cover up basically your eyes to make them look really, really small. Is that kind of the same procedure that we're talking about?
Exactly the same. And what's happening here is actually a tragedy for a woman because she can't wear eyeshadow now. And so having a good anatomy of the eye enables you to use makeup properly around the eye to make it look youthful and attractive. Eye makeup has been in use since the ancient Egyptians, we're talking about Cleopatra, used eye makeup, and that's how critical eye makeup is to the appearance of a woman.
It's not necessary, but women like to be able to use it if they want to, and there's some women that just aren't able to because they have skin in the way.
And men have this operation a lot too, because if you look tired, it's still a crappy economy, I'm sorry, and so when people are looking for that job, they want that extra edge. All the time I have men coming in that want to look more youthful because they're going on job interviews.
All right, so if we're looking at you, Doc, what kind of procedure are we talking about? Like, what are you doing? What are you...
I desperately need actually a brow lift, and this is a little nuance thing.
All right, so what do you want me to do here, Doc?
So,
get out your pocket knife, Lou.
But show us on your face, or even Lou's, like, what would you be doing around the eye to fix the issues that we were just looking at?
Okay, now see the wrinkles on the side.
What would you do?
Lou and me are not the best examples because we have thicker skin being men, and we don't show some of these fine lines like above the lip and on the corner.
Okay.
But Lou has brows kind of like mine, where the brows are are a little down off of the bone there. Mine especially so. More than a bleft, if Lou just had a little uplift like this, he would look more awake, friendlier. Well, if you overdo it, you get the deer in the headlights. But if you do it conservatively, horizontal brow.
And what would you do to make that happen?
This can be done sometimes with an incision up in the hair, pulling it from above. And in severe cases, sometimes you have to make an incision here, but we like to go from here and pull it up from above.
So you can't detect anything. Now the biggest thing for women I know is along the sides here and dealing with those crow's feet and those lines.
Yes.
What would you do in order to fix something like that?
You know, that is actually a great responder to Botox. There's operations, they're kind of like so-so. When I do a facelift, I pull a lot of that out. But Botox is a quick and easy fix.
And
for those lines there?
Yes. Botox is fantastic for crow's feet,
and you've
as
done
well
that
as
on
for
the
these.
program before, and
we had to do that again.
Yeah.
It works great.
So there are some creams out there if they have retinol, but it takes time, it takes patience, and it takes diligence. You have to do it multiple times a day. Otherwise, there are some other options if you want to consider giving yourself a little eye lift.
And there will be medical progress. There is going to be a Botox that you can apply as a cream, so you don't have to have a shot. That's probably within a 5-year window coming out, and that's going to be a game changer.
All right, so if you have any of these things going on in your life and you want to try to get a little touch up, a little tune up, you just need to stop by, right?
That's right.
Tell everybody where you're located.
I'm in Heart Plastic Surgery on Hickman near the Girl Scouts, and we'd love to have you.
All right, so get a hold of them, Heartland PS.